They were just a shell, no lights, no ceilings, no power outlets. And we came back, we thought we had a lot of potential. When we came back to Canada, we drew up a plan of how we thought it might work, and other people from Project Hands, Andrew Ray, particularly our treasurer, sent down some ideas as to how we think it would be done, and basically everything's been done. We now have a fabulous facility. It's clean, we've got the ceilings lowered so they're washable, there's air conditioning, they're a great size, and the equipment, as you can see behind me, these machines are in service in Canada, in clinics where I work. We've got laparoscopy equipment that we're just getting the final touches done, so that can be done. It's clean, it's great. It's actually a good experience to come out here, and I'd recommend it for anybody. When you come here and you see the sort of conditions that people live in and the medical conditions they have that they live with for years in discomfort and pain, and then you compare that with what we see back in Canada and the US, the conditions they have here are far more advanced. They would have been attended to far earlier in North America, whereas here you see a far more severe form of the same conditions. So it kind of opens your eyes to how other people live, and it's very gratifying to be able to help them. And they in turn are very pleased with that someone has taken the trouble to do this for them. Most of these patients haven't had surgery either because they can't afford it. Even just the cost of coming to the doctor and getting some pills is prohibitive for some patients. So having an operation in Guatemala if you have no money you just can't do it. Some are very scared, but as we've worked with patients and they've gone back to their villages and they've said, look, I had this big hernia, now it's gone, it's easy, go and do it. And that sort of multiplies and more patients come in. I'd say come and do it. This is a great place to work. I've worked in worse places in Canada. It's well equipped, you'll have a great time here. And when you get a whole group of people coming down, doctors, nurses for the PACU and the OR, and everybody else who helps out, it's a really great social event as well. So it's good.
We had no idea what to expect, what we would find here, and everything was prepared really beautifully for us. And Compañero en Salud had brought the patients. The patients were comfortable in the albergue. The clinic was nice and clean and prepared for us. All the equipment had been unpacked from the container. And we were very touched as to how well everything had been prepared for us here. I think it is an absolutely wonderful experience. I've been working in Guatemala for several years now, and to me it is an extremely uplifting experience. It's a lot of work, it's quite intensive, but the rewards for me are absolutely phenomenal, and I've heard that from everybody else who comes on a trip. There are very few people who come down to Guatemala who don't walk away with having had some kind of a really quite almost spiritual experience. And so I think this is something that I would recommend everybody to do. I think it's just a very great experience. It's a great privilege to be able to work with the people that we work, with Compañero en Salud and with the gerentes of Compañero en Salud, who are very strong, largely women, incredible personalities, incredibly helpful, and all the patients, they're just wonderful people. And for me, yes, it's a very wonderful experience to come down here.
Yeah, and this is actually my 7th trip here to Guatemala on a medical mission, and because I love the Mayan people that are here. They're so patient and soft-spoken and humble, but very gracious, and doesn't matter what we do, anything we do for them, they are so grateful for.
Our recovery room area where I was, there was 4 beds. It was really well set up. Staff was all wonderful. We were able to integrate ourselves with Guatemalan staff, and the ward where I was beautiful, clean, lots of space, and very easy to organize yourself.
Partner for Surgery's Guatemalan affiliate arranges all in-country logistics, including transportation, convenient accommodations, meals, and Spanish and Mayan language translators. Partner for Surgery also brings pre-screened patients from the remotest areas of the country, where surgical care is completely inaccessible.
Our mandate is to work with the poorest segment of the Guatemalan population. We do not have the means to find those patients to go out into the rural communities. So it's very important for us to have an organization like Partner for Surgery who does exactly that. They bridge that gap for us. Partner for Surgery is a very special organization. They are the link between us and the people out in the rural communities. The local area managers that they use are the ones that go out into these rural communities and they gain the trust of the people. So if they weren't there, then I think a large proportion of these people would never ever have any surgery at all. They would not seek surgery, they would not even know that there was any surgery there, they would not have access to surgery. We want to go to Guatemala and help the Guatemalan people, and there's no way that we could do this without the help of Partner for Surgery.
A team must be capable of organizing their own personnel, including surgeons, anesthesiologists, nurses, and sterilizing technician. With advanced preparation, supplemental local nursing support can be arranged. The team is also responsible for procuring and bringing surgical supplies and collaborating with the clinic on procedures and protocols.
El impacto que tiene esta misión, este proyecto, podríamos decirle, en las comunidades es que cambia vidas realmente porque la gente necesita de trabajar y muchos por el dolor no pueden trabajar, entonces lo que quieren ellos, trabajar bien, no sentir dolor. Entonces ha cambiado vidas en las personas, no solo la persona que es operada, sino que la familia completa.
Kuiteraj enkasha tawlich ut compañero en salud chandra geruna tatruq chiban kilach akilal anja.
Ma hokara sendo porque nakinkara sulat linskara sa hulat sa mintanamit ma para tintaus kintisingiling ulan porque sa hulat kana hokanak sin salarin.
Ella dice de que le agradece a compañero en salud porque por medio de ellos va a poder ayudar a su hijo. Sin la ayuda de compañero en salud ella no pudiera hacer nada y les agradece por haber llegado a su comunidad.
Well, you've seen the video. You see what we do here in the clinic. If you are a director or a member of a surgical team, please consider joining Partner for Surgery to become involved in this wonderful effort.